Everyone, welcome to not only the start of the work week, being a Monday, but also to the month of December. Fly on the Wall Productions bringing you the Aired Out podcast this morning, live from North Main Street, Barrie, Vermont, on the web at airedoutvt.com. Hopefully you had a fantastic Thanksgiving. Yesterday we got, it took 2 days, actually, but we got the tree up, we got it decorated, we got the Christmas decorations out, we had a fantastic Thanksgiving, and I can't believe we are already headfirst into December. It was a very, very, very busy weekend. Lots of craft fairs going on all over central Vermont. So much to do, so much to see. Main Street Barrie looks incredible. The parade on Saturday night was amazing. We've just got a beautiful city that we're looking at this morning. Below 20 for most of us waking up this morning. I think it was about 15 at my house. 30 for the high later today with a mix of sun and clouds. 19 and cloudy tonight and 28 and cloudy tomorrow. A little bit of snow that's going to be moving in Wednesday and Thursday. Not much. Could produce maybe a couple of inches total over Wednesday through Thursday. Maybe by Friday morning, we could have a few more inches on the ground, but just be careful driving. Dee Rollins on the birthday list today, along with Aidan Crandall, Jake Larrabee, Ava Rose, Barb McHenry, Don Dussault, Cheryl Trombley, Chris Hull, Alexis Collins, and Renee Francis. Very happy birthday to you on this Cyber Monday, also Special Education Day today. I have two ladies that I have been wanting to have on the air here for quite some time. Sandy Rousse, Emily McKenna from Central Vermont Home Health and Hospice. Very good morning to both of you. It's a pleasure to see you.
Good morning, JD.
How are you? Welcome to the studio. Emily, I think this is your first time here.
First time.
Sandy,
happy to be here.
Yeah, I'm happy to have you. Sandy, you've been on a couple of times in the past.
Yes, I have. Always great to return.
Yeah, it's wonderful to see you. Happy Thanksgiving to both of you.
Yes,
I hope it was a good
Same
one for you.
Yeah, yeah, it was very nice.
Good. So here we are. My gosh, it's Cyber Monday. Tomorrow's Giving Tuesday.
Mm-hmm.
We had Small Business Saturday. I don't know if we have any more staple holidays here.
I think so. No, I think we're done tomorrow.
Right. Yeah. We're going to be talking about Giving Tuesday in just a little bit with regard to how folks can give to Central Vermont Home Health and Hospice. Mm-hmm. And so many of us this time of year, we have a lot of giving in our hearts. Mm-hmm. And man, you guys are in need of some assistance when it comes to continuing to grow the family of Central Vermont Home Health and Hospice. Mm-hmm. You've got a family right now that's pretty big, but it's growing, and there's a lot of people out there that are in need. And is there a lot of help coming from the state of Vermont with regard to what's coming to Central Vermont Home Health Hospice?
Well, with regards to from the state of Vermont, obviously we're a key part of the healthcare system, the broader system. So the state is certainly aware of that and acknowledges that, and we have good working relationships with our state partners, let alone our legislators that represent our Central Vermont community and the 23 towns that we serve and all of that. With regards to funding for Central Vermont Home Health and Hospice, the majority of our funding comes through Medicare, so that's more at the federal level. We have significant support from our 3 delegates in Washington, D.C., and it's really federal advocacy that's key at this point, and that's pretty hard from a state that only has 3 people that aren't necessarily completely plugged into all the committees that make all those changes and decisions.
Yeah. Emily, if you ever want to jump in, you just jump right in. There's no rules here. You just you got a microphone. So anything that you wanted to add to that?
Well, I think from my perspective as overseeing fundraising with Sandy, I think my goal always is to help sort of empower people in the community to talk about their experiences whenever they have a touch point with CV, HHH, and home care, to talk to their physicians, to talk to their friends, to say, hey, I had a really great experience at CV, HHH. And I think that just sort of has like a ripple experience out and gets to the right person and gets to the right person and the next person. I think home health typically or tends to sort of go under the radar, and we really at this point right now really need to talk about how important our work is and the impact that we make in the community, keeping people at home, providing health care in the setting where people want to be.
Boy, is that key right there.
Yeah.
Keeping folks want to age at home.
They want to age at home, I think. And one of the things that the Fall Appeal Chair, the son of the Fall Appeal Chair, talked about was, he said if mom had to go into the nursing home, he said, I think she would have had a very different experience. He said it was key to her health that she could be at home. And so there's a shortage of nursing home beds, and there's the focus is to keep people in the home,
sure,
system wide. So I think we need to talk about as a system how important it is that we keep people at home and we provide care where people want to be. And so I think from my role as the marketing director and as the person who's sort of overseeing fundraising for the organization, I want people to share their stories and talk about their positive experiences with home health.
Yeah.
And the honorary chairs, the stories that they're sharing, these 2 local guys talking about their mom, Kristen Haskins.
Yeah.
We've seen the photos, I think, in the World newspaper, also on your social media too.
Yeah.
Unique that we have some folks that are living
Right.
and doing well as testimony to what Central Vermont Home Health and Hospice has done for them.
Yes.
Yeah.
Yes, it's definitely unique, and from the perspective of most times our appeal letters are focused on individuals that have either had care with us and or from a family member who's had somebody on hospice who's passed.
Sure.
So this is a really unique opportunity for us to really talk to individuals that are actually really going through it now.
Right here.
Versus after, here in Barrie. And we're very fortunate to have this family, and certainly you can just tell by the photos the love that happens and the feelings that they have being with each other and being able to care for their mom at home in the community.
Yeah.
And definitely the things they do together. I know Emily was certainly in touch with the family, and I'll let her talk a bit more about that.
Del and Walt, 2 really good, close sons.
Yeah.
And their relationship has improved significantly with the help of what you guys have been able to provide for them. Just the 2 of them, but also their relationship with their mom. And that's part of the big picture here.
Yeah, so we connected with Walt through our palliative care nurse practitioner, who had a few meetings with the family at Kristen's home in Barrie. And when we talked to Walt, he was so articulate about the relationship and the connection with his mother. I was thinking about that on the way over here, and he was saying, they moved around a lot when they were growing up. He was saying he said maybe we moved in 16 times. We lived in many different apartments, and he said, we didn't have a lot, but Mom always made Christmas nice. And he said, for me and my siblings, she always gave each of us one nice gift, and that really meant a lot. And he said she was such a creative person, and she passed that appreciation of art and being creative to me and my siblings. And he just talked with such affection and respect for his mother, and it made such an impression. And he said, again, we didn't have a lot, but she always made sure that we watched good movies and read good books. And it just it was so clear how much he loved his mother. And I just thought it was so it was just so sweet. And so now at this stage of her life, and when she needs this care, he and Dell, his brother, have come together, and they're her primary caregivers. They had a sister who passed from cancer in 2022. And I think when he was sharing the story of how things have progressed over the past couple of years, he said that was sort of a turning point. They started to notice that her behavior was different, things were shifting, but when their sister died, she sort of became nonverbal, and eventually she was diagnosed with Alzheimer's. And so that was a point at which they decided they needed to figure things out. And so they are her two primary caregivers, and they it sounds like they each take a shift taking care of her. And, just the way that they talk about the benefit of the time that they have with her now.
What a gift.
That's essentially what he said, that it is a gift. And our palliative care nurse practitioner, Kelly Elwell, had a conversation with the family. They eventually decided to sign on to hospice with CVHHH. And so they are together figuring it out, and Kristen gets care at home, and so they're all figuring it out together. And I think they're thriving with support from CVHHH and getting to spend some really important quality time together as a result.
I have had direct experiences with you guys as well, with both of my parents, and it's what's amazing is you don't realize, or it's hard to realize the value of it until you've had it.
Yeah.
And how, frankly, desperate you are for help. How much you need it until you need it. And I'll tell you, for anyone watching or listening who has, depending on maybe your age, your circumstances, if you haven't yet needed home health and hospice, either for yourself or a loved one or your mom or dad, the likelihood that you will is very high, because we're all getting older, man. And this is aging is a complicated thing. Everyone has a unique, different story, and it's very involved. There's a lot of stuff going on here. There are many, many, many conversations that have to take place with palliative care. Can we just get more of a clearer understanding of palliative care, or what this means?
Yeah. Sure. So our program at Central Vermont Home Health and Hospice is overseen by a nurse practitioner. Her name is Kelly Elwell. She's a doctorate of nursing practice. And Ultimately, our service is a consultative service where we really try to use the healthcare team that's in place.
Yeah.
So when I say healthcare, I always say two words because it's not just the medical aspect of care, it's all the other things that come with it, whether it's mental health or housing or
Sure.
any of those other things that impact individuals being
sure.
able to medically be in a good place, and all those things affect it. And ultimately, we're really focused on individuals that have a life limiting illness and they may be seeking treatment. If they have cancer, they could have Parkinson's disease or MS or anything like that, that really is a disease that is going to progress and potentially put them in a place where they're going to really be focused just on quality of life and comfort care in the end. But ultimately, you know, it could be pain and symptom management, it could be emotional support, it could be connecting them to resources, goals of care conversations when you're having a discussion with someone around their disease progression and also with their family member or that person who may be their primary caregiver. Ultimately, it gives you a chance to really think about the future and think, geez, you know, do I really want my spouse having to do my personal care?
Right.
What does that future look like? And it's really good to start now, especially if you may want to consider being in assisted living, or maybe a skilled nursing facility is really the place where, based on your disease progression, you may have to end up. And by knowing that now, and your family members or your loved ones knowing it now, it's really critical.
I wish
And-
these conversations were taking place
Right.
much earlier
Yes.
in my family.
Yes, exactly.
Yeah.
And ultimately, too, part of it is connecting them to other community resources. You know, certainly we provide certain things, but there is a whole host of wonderful organizations in central Vermont, let alone in the state, that can support individuals as they're going through all of this. So, and this, the DNP works very closely, Kelly works very closely with our hospice program as patients transition. And that program has a medical director, Kelly's a nurse practitioner, we have another nurse practitioner, and a whole host of individuals that can support someone who's made that decision to go onto hospice.
My goodness, there's so many tentacles here. I mean, you know, I'm thinking of everything that that my mom and dad went through, and just literally constantly, every single day.
Yeah.
Right,
There was none of this Monday through Friday stuff. I mean, every day they were, how am I going to do this? What about finances? What about this?
Right, Yeah, and ultimately in healthcare too, from the perspective of the staff and what they do, you know, there
They've
really
heard it
is
all.
no holiday, so to speak,
No.
in healthcare for anyone, because you know people's health is
Yeah.
you can't predict it,
Right.
and it's going to happen no matter what. I know one of the things that with this appeal letter that really came out is obviously Dell and Walt's relationship with their mom and their mom's relationship with them. And one of the things, on occasion, I'll pick up the phone and call a family member of someone who may be on hospice and just talk to them. Say, hi, how are you? How are things going? Etc. You know, are you getting what you need? And also talk to them about our role in this healthcare team, in this team, extended team with family and caregivers, is ultimately not just to take care of the patient. It's to take care of the family as well.
Yeah.
So really
Great
thinking
point.
about, you know, what are those things? I like to ask the question, you know, what does, you know, your loved one want to do? What do you want for your loved one, and how can we help? Because ultimately that's our role. And we want to connect you to resources to get you to that last basketball game of your niece that's in the NCAAs. And how can we do that? Okay, really? The thing that needs to happen is we need this, you know, we need him or her, you know, pain managed to be able to get them out
Right.
and get them where they need to be. And I'm like, we can help you with that. That's
Yeah.
our role.
And-
we can work with your healthcare team to make sure that
Sure.
happens.
And mobility, and
Right.
it's comfort, but it's also logistics and mobility to get someone to where they need to be.
Right.
Well, what Walt said is that he was hesitant at first, and he's sort of come to see how support from our hospice team has given him and Dell and his mother the opportunity to find time together, and they do things now. They go on drives every weekend. They get coffee.
Yeah.
And he talked about, I get to see my mother every day. I make her laugh every day. She gets excited when she knows that we're going to have her favorite food.
Tater
I love
tots.
that. Tater tots.
Yeah.
And it was just like all these things. He's like, every day is present moment. We communicate. We love each other. And he's
Sure.
like, so many people lose touch with their parents. And he's like, it's given us this chance to find this time. And that's really, I think, from our perspective, what hospice can give families. It gives them time to focus on time together when it really matters most, when you're facing, the end of life. And the last thing I'll say about is that he said this really incredible thing. He said, CVHHH is shining a light in the path for us. And when he said that, I was like, oh my word, it just was so beautiful and articulate about what this experience has done for him and the family. And I loved that. That's how he saw the experience.
Well said, because it's so easy to get overwhelmed here. I was very much, both of my parents at the same time kind of shifted gears, and it's so overwhelming, and a light on the path. Yeah, and it's well said.
Yeah.
And also important to note here that not everyone has two sons that are living right here and both fully invested in taking care of their mom or dad or loved one, which I'm guessing might stack up a little bit of extra weight on Central Vermont Home Health and Hospice, giving you more work to do. You have to become the family.
Right. And it's, it really too goes back to palliative care and really thinking about that disease progression and thinking about, like I said, is there going to be a time where an assisted living environment is appropriate, or a skilled nursing environment, and or are you going to have another caregiver on your team or others to be able to provide all that support at home? So certainly I know our staff are very committed to the work they do.
Yeah.
And it's close. When the staff primarily live in Central Vermont, and when their neighbor isn't feeling well, that impacts them and how they live, even though they go to work every day and they leave. And granted, we are available 24/7. It's still, when your neighbor's not well, you can't sleep at night. And that's what they take with them every day.
What a tough job being in the healthcare industry.
Yeah.
No matter what facet it may be, from emergency rooms to nursing homes, skilled nursing facilities, home health and hospice. I mean, this is a tough job. I'm not entirely certain I can think of anything that would be tougher. Emotionally, physically, in so many different ways. And here in Vermont, we have younger folks that are getting into the nursing field. How has that looked? Has that been dialed back a little bit? Does it seem like there's as many younger folks coming out of nursing school as there was in the past?
Yeah, I think there have been some restraints with programs with regards to, having the capacity within even our Vermont school system, college system, a university system to allow for that. Although I think there are a lot of innovative programs that are taking place. There's a lot of effort focused on healthcare workforce. There's a lot of employers that are looking to do things differently, to have individuals come in. Maybe you come in as an LNA and then you grow to be an LPN and an RN, and it's staged versus entering college knowing that you want to be an RN and trying to get into a program that may be fairly competitive just due to the number of slots they have based on the amount of teaching capacity they
Sure.
have.
Sure.
So certainly from that perspective, there could be a lot more nurses, physical therapists,
Yeah.
all really licensed nurses, aides. Those individuals are key. They're probably the ones that spend the most time in the home and are closest to the care with regards to personal care. They're a significant part of the team in healthcare, any aspect of it, in any part of the field in healthcare. So all of those are, definitely there are needs and lots of them, not only in Vermont, but nationally.
I'm guessing a good many of these caregivers get very attached to those that they're taking care of.
Yeah.
I can only imagine.
I always say if I was a clinician, it would be very hard for me. I'd probably get one visit done a day
Yeah, right.
because I would be
Yeah.
totally
Yeah.
steeped in
Same here.
to what's happening.
Yeah.
But ultimately with hospice, what's really great about hospice is it has an interdisciplinary team that really works together in the sense of we have a chaplain, we have a volunteer coordinator, we have a bereavement counselor, we have nurses, we have licensed nurses aid, medical social workers, a whole team, a host of individuals that
Sure.
can really support these individuals at home
Right.
and their families.
The list of benefits of being able to age in place, to age at home, I'm sure that the list is a mile long.
Yeah. And often when we talk to patients or family members of patients who have utilized our hospice service, they say, I would say 9 times out of 10, they say, I just wish we'd known about this sooner, because they talk about it's often the simple things like being able to be in your living room chair, your own bed, coffee, just these little things that make up, the sense of home, that mean a lot to people. So.
And pets.
Yes.
and
Oh,
pets,
yeah. I
yeah.
always say family, friends, neighbors, and pets.
Oh.
And
Yeah,
I
Sandy
always
does
think
always say
about
that. Yeah.
having that cup of coffee
Sometimes
at home.
Yes.
you have, right, exactly,
Yeah.
sitting in your own couch.
Right.
Yes.
Exactly. Like, no, yes, to a degree, there may be diet restrictions, but ultimately, when somebody's chosen hospice,
Sure.
I always say they should be able to
Right.
do what they want to do at that
Yeah.
point in life, right?
course.
Like, what matters most to them.
Yes.
I had an experience with my dad out of state, and he passed in a hospital setting, and he had, significant cancer throughout his body, and all he wanted to do was have a cigarette. And I wanted to take him outside to have
Yeah.
a cigarette, and I
Yeah.
couldn't. And that was his relaxing thing. Like, I knew he needed that to just
Yeah.
relax. And the answer was no. And I should have just done it. Like, thinking back, I should have just done it. What's the worst they could have done to me, right? But ultimately, not wanting to give the healthcare system any problems. I say that in a respectful way.
Yeah, sure.
And if he was able to be at home, he could have done that.
Sure.
Yeah.
And we talk about pets too. It's like you can't be always sneaking them into hospitals
Yes.
either.
We've
you know.
actually had a staff person who adopted somebody's pet
Yeah.
after they passed.
Yeah.
So there's definitely those attachments that staff do take with them.
Yeah.
Wow.
Yeah.
The timing of you both being here this morning is fantastic because the appeal, the fall appeal, is ongoing right now,
Yep.
and with Giving Tuesday tomorrow,
Yep.
how can folks help out in
Yeah.
some way, shape, or manner here?
So we wanted to do something. We wanted to do something a little fun to sort of kick off giving season, and recognize one of our longtime sponsors and donors. So Giving Tuesday is tomorrow, December 3rd, and starting tonight at midnight, donors can participate in a Giving Tuesday match that we have from J.A. Gould Plumbing and Heating. If we raise $1,500 on Giving Tuesday, tomorrow, December 3rd, J.A. Gould Plumbing and Heating will match that amount dollar for dollar. So we will have $3,000, and donors sort of benefit because their donation will sort of go double. Yes, thank you. I'm still sort of in Thanksgiving recovery, and and then CVHHH will benefit because we'll have $3,000 to support all of our programs and services. So the Giving Tuesday, we have secure online forms on our website at cvhhh.org, or if you're more comfortable calling the agency, you can do that as well. But the form for Giving Tuesday will open tonight at midnight, and it will run all day. And our goal is $1,500 tomorrow on Tuesday. So
Let's say this. We're not looking for, I think, fair to say, not necessarily any big heroes here. We're looking for, the power in numbers.
yes, exactly.
$10
It all
here
adds
It will
up.
add up. It will
will
definitely
add
add
up.
up. Yep.
Yes.
quickly.
Yes, it will.
Wow. And this is supporting, can you list off some of the programs?
Sure. Why don't you go ahead?
Yeah, so we have, I would say generally we have a home health program. We have our hospice program. We have a long-term care program and a family and child health program. And within our home health program, that program provides skilled nursing,
Yep.
Rehabilitative care. So that's physical therapy, speech therapy, occupational therapy for people at home, nurse's aid, which is the licensed LNA at
Medical
home,
social worker.
and a medical social worker for people at home. And then family child health is just another really incredible program that provides nursing, medical and non-medical care, education, support, sort of community resource.
Wow.
For it's prenatal, it's perinatal, which is like pre and post pregnancy and birth. It's an incredible program that helps women and families and children at home. It is, every time I talk to our nurse manager, I'm really sort of in awe of it and what it accomplishes for people. Yeah.
And Sandy and I have talked about that a little bit in the past on the air here, and it's unbelievable.
It is.
Right.
Yeah.
We're fortunate that really we're pre-birth through end of life. So we really take care of individuals at every end of the spectrum. I myself have benefited from the services, especially from family and child health. I had a high-risk pregnancy. And I trust the people that I work with to take good care of me or family members. My husband has accessed home health after he's had joint replacements. He's had 2 knees and 2 hips. And thank goodness for them. I couldn't wait for them to arrive. And frankly, he couldn't either because he wanted to get up and go.
Sure.
And it really allowed him to do that.
Yeah.
And then we've had family members and close friends on hospice. And certainly, too, with our palliative care consultative service.
yeah.
That's
Yeah.
another service line we added in 2023. And that has just added just a wonderful element of being able to really help individuals get the care they need in under the program or service they need within the organization.
Yeah. Some nice comments. Shirley saying, thank you for all your remarkable work. Donna saying, thank you for what you do. Very hard work. Jeff Gould, longtime supporter and sponsor of Central Vermont Home Health and Hospice, as you've mentioned. His mom, Barbara, a patient.
Yes.
Yes.
And a nurse for 50 years right here in
Right,
Central Vermont.
Right. Jeff and Elizabeth were honorary chairs for an appeal a couple of years ago, 2022. Spring of 2022. And they had a wonderful story about their mother, Barbara, who is a former nurse. And one of the things that they wrote that I remember, and I went back and refreshed my memory a bit, that really stuck with me, is when they were talking about hospice and the support that they were getting for their mom at home. They said it's gut-wrenchingly sad and incredibly beautiful all at the same time.
Wow.
I thought that was pretty powerful. And Jeff always participates in our annual golf tournament that benefits hospice. It's really nice to see him there. He's very connected to the community. He supports a lot of organizations throughout this community. And we're really fortunate that he's willing to support us on Giving Tuesday.
Yeah. $1,500.
$1,500. Yep. Opens tonight at midnight. Yep. We'll be sending out reminders on our Facebook page, and we have an email sort of marketing to our our donors and people who are connected with us. So we'll be continuing to remind the community.
Okay.
Yeah.
Will it end at midnight?
It's midnight to midnight. Yeah,
Midnight to
so
midnight.
we can capture it within that 24-hour period. Yep,
Right.
that's our goal.
This is incredible.
Yeah, we're very lucky. We have, I mean, Sandy often says we have a very committed, generous
Community.
who supports us. Yeah, they
And
come
there are
out.
a lot of great organizations in this community. I work with a lot of the leaders of those organizations, and we're really fortunate and honored to be on individuals' lists as, they think about donating to
Yeah.
these organizations.
Yeah.
Yeah.
We're pretty lucky.
It's the lifeblood of everything. I mean, everything. We've got to take care of one another. We've got to take care of ourselves, our families. It's tough being a caregiver, whether it's another family member or whether or not you're a staff member for Central Vermont Home Health and Hospice. I mean, this is tough work.
Yeah.
It is. I recently, we had a manager leave in our hospice program, and I was downstairs with the staff and with the team for about 3 months, along with another RN co-leading the team. And it's pretty incredible. Like, for me, that's a space I really enjoyed being in, to hear the stories and hear
Sure.
the staff and really work with them. There are times that it was really, really difficult, and from all aspects. And then there were times that were really beautiful, as said by Jeff and Elizabeth in their appeal letter a couple of years ago. And the staff are really committed. What they go through to try to make things happen. And like anything, nothing's perfect. There's always room for improvement. But it's pretty incredible to be at that level and really see through their eyes the work
Yeah.
and the care that they're providing.
I know I asked you a little bit about the state of Vermont, but is there anything that Central Vermont Home Health and Hospice would like the state of Vermont legislators to be more aware of, or to be more familiar with either the work that you do, how important it is? I know that you've been under the Golden Dome a few times.
Right. Yeah, so like I said, our legislators are very supportive of us. Obviously, as new legislators come in, we'd love to have the opportunity to have them even go out with a staff person in the field. That's really key. Our staff are pretty amazing. They love to, bring people around and show them the true work they do out in the community and what it looks like, and what it looks like in real time, so to speak. From the perspective of that is really a space where we'd love to have more legislators throughout Central Vermont, let alone throughout the state, work with our VNAs to really go out and get that look. Like I said, federal funding for a lot of us is to a degree out of their control. They support us. They support us with the delegation. Ultimately, I think there's more that maybe they could learn about us and our work and how important it truly is to the healthcare community. Ultimately, if we're trying to have individuals live in their home, in the community, and shift care out into the community,
Yeah.
then
That's
it
huge.
takes more than one system to do that. One part of the system, I should say. And I definitely would like to see the state focus a little bit more on the whole system versus just key components of it. So I think and that's pretty broad, because there's a lot of things that impact individuals' health, and it's not just medical care, as I said again.
Sure.
There are a lot of different things, and I think I'd like to see us look at it more not as hierarchical versus bidirectional. And I say up and down, but ultimately horizontal,
Yeah.
because that's really key. And there's a lot of need. There's a lot of individuals that need caregivers on a regular basis. When you think of it, a lot of families, their children are moving out of state.
Yeah.
So
Yeah.
they're not here. And I'm not originally from Vermont, my family is, but ultimately Vermonters are pretty independent, and they want to do their thing, and they want to be home and do their thing and not be told what they have to do and how they have to do it. So ultimately, how do we build a system together that supports that?
Wow. That was a lot right there.
Yeah.
And you're right. So many of us, we dig our roots in pretty deep here, but there is a sector of the population that is moving around and seeing how warm those beaches can get down there, and we've got moms and dads and family members
Yeah.
that are staying put for the long haul,
Right.
and frankly, this is where they've been their whole lives, and this is where they want to pass.
Right.
Is in the state of Vermont.
Exactly.
We need to have everything in order to be able to facilitate that. And I think it was you, Emily, that said that our skilled nursing facilities are just, they're at capacity everywhere.
Yeah.
Not just here in Washington County,
Right.
everywhere.
They are everywhere, and not just in our state, nationally.
No.
Yeah.
I think there was a lot of movement at one point in time with different programs of how to keep individuals in the community, right? But certain states have a different demographic than others, such as Vermont and Maine.
Yeah.
And
Right.
we have an older demographic. So then what happens when those individuals can't be in the community and there's not enough care providing and or that whatever program they may be part of that has allowed them to stay in the community doesn't cover 24-hour care. So
Yeah.
what does that mean and what does that look like? So needing to have those beds or needing to have housing or older adult housing that ultimately supports the demographics is definitely a need. I think if you go out into different states like Arizona and places like that, you see like these communities for older adults. It's like
Yeah.
we don't have a lot of that. We have some of it, and it just depends.
Yeah.
A lot of it is private pay,
Sure.
which is not affordable for some
Yeah.
people. So.
No. Did you want to add something?
Well, I
on?
was going to say there's to your point about the non-medical need. We get calls from people who are generally healthy, who are older into their 80s, who just need help with, who need help with things like groceries, cleaning. So there's that component of it too. So I think even informing, just educating people at the state level that I don't know what the solution is necessarily, but they look to us for help and they call us, and that's a component of the need in the community as well, because people are living longer and they've managed to stay healthy to their credit, and I don't know.
Are there any opportunities through Central Vermont Home Health and Hospice for volunteering, for just checking in on folks? Even a phone call. Hey, how you doing? I'm heading to Price Chopper. Can I pick something up for you on the way, or anything like that?
We don't necessarily have a structured volunteer program like that for our hospice program. We actually do have a volunteer program that does all sorts of things for individuals and their families. So if you are interested in supporting our hospice program and those patients and families that are on hospice, definitely that's a space where it is more coordinated and there are more specific things that we can have volunteers do for those families. One of the things too that I didn't mention with our hospice program is we have a Dinners for Love.
Dinners with Love, yeah.
Or Dinners with Love,
Yeah.
sorry. And ultimately we partner with some of the local restaurants
Yeah.
that actually provide meals, and our volunteers deliver them
Yeah.
to families and patients that are on hospice.
Wow.
So we're really fortunate, once again, another way that our community gives
Yeah.
to hospice and gives to others, definitely paying it forward. So we're fortunate to have that. With regards to other volunteers in the agency, we do use volunteers administratively for our work. So that gives people an opportunity to come to our building, to be connected in different ways, and really be ambassadors out in the community based on
Yeah.
the work we do. So we're really fortunate from that perspective.
Wow.
And we work with other networks. United Way has access to a volunteer network. Our councils on aging
Council on Aging.
So our
Sure.
goal is to really connect and work with other community providers to connect people to community resources. That's a
Wow.
lot of what we do as care coordinators, is how do we connect others.
If folks have questions, can they literally just walk into Central Vermont Home Health and Hospice on Granger Road?
Yes, they do.
Can, yes, they do, and they can, or they can call us and they can ask for, they can ask for me or Sandy.
Okay.
We always happy to talk. Yeah,
Right.
definitely.
And of course, have a look at the website, because you're going to be there for a while. That is a really in-depth website, cvhhh.org.
.org. And
There's
our
a
Facebook
lot.
page.
There's
yeah.
a lot of stuff on there.
Yeah.
Not just career opportunities, but just a wealth of information.
Right. There
And
is.
fundraising opportunities. You mentioned your golf tournament. Is that something that's going to come up in the spring, or?
It will, actually. It's usually around June.
Yeah.
Okay.
And we're really fortunate. I mean, we sell that golf tournament out every year. And once
Yeah.
again, that's just another place where our community supports us.
Yep.
And we're really fortunate to have that support. We love seeing, sometimes I only see some of those individuals once a year that
Yeah.
are,
Yeah.
come to play. And,
Does
and
Eddie get
that's-
out there?
He sure does.
Sure. Is he able to put the hip into it?
He definitely, that's a huge goal for him
Yeah.
when we talk about quality of life
Sure.
Yeah.
and all of that. So definitely he's a huge supporter, and he's helped bring individuals into
Wow.
playing in that tournament. So
Iron Order
Very
helped you
grateful.
guys out with a big motorcycle ride
yeah,
a couple of years ago.
Yes.
I think. Is that something that might happen again?
We're
been a couple years.
I think that's been. I think we did that in 2022. I came on to oversee the fundraising function in August. So we're taking a look at everything, and we're figuring things out. So I think to be determined. Yeah.
Yeah.
What our events look like.
That's
yeah.
exciting.
Yeah.
In the meantime, this is a perfect time if you are feeling it in your heart to give.
Yep.
With Giving Tuesday, to wait till midnight tonight
Yes.
and get on cvhhh.org and make a donation. It's secure, it's online, and pardon me, it's going to go a long way to helping all of your programs
Yep.
that you guys are so busy with. Where are we at for staffing here? Do we have opportunities for folks to get involved with Central Vermont Home Health and Hospice?
Absolutely. We are looking to hire all sorts of staff at all sorts of levels, registered nurses, therapists, LNAs, and definitely you have the option with our home health program, with our hospice program, and certainly it's an opportunity to really provide care and at every level. Like lots of times, potentially if you work in a hospital setting, you're doing a certain level of care, and then somebody else is doing wound care, somebody else is doing the IVs, etc. This is a place where you really get to use all those nursing skills in one. And there are all levels of staff that are working with us, those that have been doing it a really long time, others that are fairly new to it, some that are kind of in the middle of it and learning all those different things. And ultimately, too, you learn about a lot of other great organizations, because part
sure
of
you
your role is connecting, individuals and families to other resources in the community. So it's a real opportunity. You get to, really set your own schedule, and ultimately get in and out of your car, have your time to yourself after a visit, and ultimately have a little bit of freedom, so to speak. And if you love being out in Vermont, you get to see all that landscape and country all the time, and you get to meet people, and it really connects you to the community. When you're in somebody's home, you are definitely connected.
Oh, sure.
In a way that you may not be connected in other settings.
Again, Giving Tuesday is tomorrow. and you're going to double your donation if $1,500 is matched.
Yep.
So if you you give $25,
Yep.
it's instantly going to turn to $50 if we can reach $1,500.
Yes.
Yeah. And I was every dollar. I mean, really, every dollar counts. I think.
Yeah, literally.
I think it does. Yeah. So.
Wow.
Yeah.
Is there a way to do this anonymously?
We collect people's contact information when they donate.
right.
But if someone doesn't, we don't share it. So
Sure.
yeah, I mean, sure.
Okay.
Yeah. They don't. We're not. Publishing any of this information.
Sure.
And
All right.
And
Yeah.
sometimes they'll know wanting to be anonymous. Or
Yeah.
we
Right.
don't
whatever,
generally
so.
we don't generally publish donations unless someone wants to share or if they make a big gift. So yeah.
Can we, at some point during the day tomorrow, can we chat real quick by phone? And
Yeah. We can
Kinda
share.
just-
We can share an update. Yes.
All right.
Yes, definitely.
that would
yeah.
be great.
We'll let you know. We'll let you know how it's going.
All right. I would love to post that up. And,
Yeah. Thank you.
That would be great.
Yeah.
Big shout out to Kristen Haskins and her two
Yeah.
sons,
Definitely.
Dell and Walt, right here.
Yep.
They live right here in our community,
Yeah.
literally a couple hundred yards away.
Right.
And wonderful people who have stepped up and said, we want to provide the testimony of what Central Vermont Home Health and Hospice has done for our family, not just for our mom, but for all of us, for our whole our whole family. It's really significant, really profound that they've done this.
Yes, it is, and we thank them. And it's
Yeah.
a really great to have a story like this
Yeah.
because, like we said, it is unique. Usually, it comes from the other perspective of someone has passed on hospice and
Sure.
they're talking to their family afterwards. But really, it's a real life, real time thing that we're going through. and
Is this the
it's
first time that we've done that with Central Vermont?
the first
In
time
my-
I can remember?
Yeah. In my history with the organization, I think. Yeah.
Yeah, we've done others like home health. Lots of times it can be
Yeah.
someone who's actively on home health.
I think so.
But for hospice, I
Yeah.
think it's probably the first time where
Yeah.
we've actually done an appeal letter that's focused on
Okay.
someone being currently on hospice, a
Right.
patient currently on hospice and their family.
Yeah.
And certainly not only the services and program has done for them, but certainly what they do for us.
Right.
Sure.
Because by them choosing us, we're honored that they choose us to care for them and their family.
Of course.
And certainly it's an opportunity for us to really look at things through a different lens because everybody's circumstances are unique. We learn in every situation.
Sure.
So whatever we do
Constantly.
for one, we are
Yeah.
constantly learning because it looks different every time.
Yeah, right. Wow. You want to come in sometime and talk Medicare and Medicaid and all that fun
Yes,
stuff?
we'll be back. Yes, we'll be back in the beginning of the new year.
Yes.
Definitely.
All
Yes.
I'm sure there's a lot to unpack with regard to that.
There definitely is.
There is
yes.
a lot.
Yeah. Let's do it. Let's do it. We'll set a date. We'll make that happen.
That sounds good. Yeah.
In the meantime, God bless you both, and God bless Central Vermont Home Health and Hospice for all you do. As you said, Sandy, it's 24 hours a day. It's 7 days a week. It's during the snowstorms. It's during the icy roads. It's on the holidays. It's all the time that you guys are there for Vermonters, and it's we're so blessed to have you.
The work
All of
that
you.
our staff does really makes my job easy.
Yeah.
And I'm really proud of each and every one of them. They
Very
give
grateful
their
for
heart and
them.
soul to
Yeah.
everything they do.
Sure. CVHHH.org.
Yes.
Make sure you get on starting at midnight tonight, Giving Tuesday tomorrow, if you can make a donation, no matter how big or small. If we get $1,500, your donation is going to be doubled.
Yes.
That's huge.
Yep.
Thanks to Jeff Gould.
Yeah.
Very
J.A.
much.
Gould through his company,
Through his
J.A. Gould Plumbing and Heating. Yeah.
Yes.
Wonderful.
Yeah.
Thank you both for coming in here.
Thank you so much.
Sandy
Thank you.
Rousse, President and CEO, and Emily McKenna, who is in charge of all things marketing
fundraising.
and fundraising.
Yep.
And wow, what a job.
Yeah.
What a job.
Thank you.
Thank you both so much for coming in here this morning.
Yeah.
Thanks,
And,
Jada.
have a
Thanks
great
a
rest.
lot.
Yeah, have a great rest of your Monday.
Yeah.
All right.
Thank you very much.
All right.